So we hope that this is really a conversation where we can learn from each other. And I'm really excited. When I didn't realize it was such a pitch, after I went first, everybody was making their pitch. So phew, some people came.
You convinced us to join, so it was a good one.
Well, and I hope we learn from each other. That's the idea of these. So Megan and I will frame it, but then we really want to hear about what's happening. There she is. Hi, Megan. How are you?
Hi, everyone. It's midnight here in China.
Oh. So we don't get to see your son
for a while and wake up from my alarm.
Thank you for doing this for everyone.
Yeah.
All right. Well, I'll be hosting the conversation, but Megan is going to have as much to share as I do, and then we hope you all have to share. So I'll just give you the framing. We're going to give you an overview of what the Early Learning Fellows have been talking about in about a minute. And then Megan and I will each give you like a 3-minute overview of early learning in our countries and some of the key points. And then we'll talk about an innovation going on in our country. We've each picked one. They're very different from each other, though we face many of the same challenges. And then really want to have a conversation. So we see, you know, the first 20 minutes as a sort of framing, and then the rest as conversation. So I'll just launch in. Is that okay with everybody? Any questions? Ready, Megan? There we go. I'm going to share my screen right now and just say that we have been really taken. This Salzburg Institute's amazing. 6 very different countries. So South Africa, Uganda, Tanzania, China, and the United States. And after our first and second meeting, we realized we are all facing such similar problems and challenges. Unlike some of you are in countries where there is more investment in early learning, but our countries, as a rule, have pretty fractured systems that aren't quite national systems. There are some federal investments, but like you all, I think we're all worried about child outcomes and readiness for school. And to Dominic's point, we're very concerned about kids' ability to survive in this world, their ability to build executive function skills for that. Who knows what's coming their way? All of our countries have challenges with access and access for all. That is, people in lower income and in rural regions of our nation struggle with access to early childhood. All of our nations have programs in place to improve the quality of care. And as a rule, quality is very uneven in all of our countries, where some programs are super high quality and many are not such high quality. The thing that Megan and I had the most in common is we're both in public-private systems in China and the US, and both systems are looking to move to a more government-funded system, but there are businesses in place resisting those changes, both businesses that provide the services and businesses that are worried about their taxes. And I don't know about the tax system in China. It's a little different than the US, but Megan's been dealing with the private businesses of doing childcare want to keep their businesses going. And they've passed some interesting laws that she'll talk to you about to try to manage that. But who knew when we met that China and the US would have the same major blocks in place? And then there's been a big focus on social and emotional development in all of our countries. And I think the pandemic is part of this, that all of our countries have been dealing with. Everything that was hard is harder now. And so those things that were weaknesses have been exposed. And then really the professionalization of the workforce is an issue. And I'm really interested to hear what's happening in your countries there, because in most of our countries, these are not well-paid jobs. So that's the common thread that we wanted to just kick it off with. And I'm going to turn it over to Megan for about 3 minutes to talk about just the overarching themes right now in China and what you call kindergarten, which means those earliest years. So Megan, why don't you take it away?
Okay. I want to share my screen.
Great.
Okay. Hello everyone, and I'm you can call me Megan, and my Chinese name is Wang Henan, and I'm from the National Training Center for Kindergarten Principals. It belongs to the Ministry of Education from China, and I will introduce some of the preschool education system. And first one is some basic situation. According to the data of 2020, we have currently now it's more than this number. We have nearly 300,000 kindergartens in China, and more than I'm not very good at the numbers. You can see the numbers here, and we have so many children in kindergartens, and about half of the kids, they are in private kindergartens. So this brings some problems for the government. The first one is the quality of these different types of kindergartens is uneven, just as Beth just mentioned. For example, some private kindergartens, they pursue excessive profits and they have low teacher qualification. And the second is the inclusive resources provided to parents are insufficient, and the proportion of preschool education costs borne by family is very high. And the third is there are great differences in the investment between our local governments, because it depends on the province that who will invest the money in this preschool education, and so on. Yeah, these are some pictures from our kindergarten. You can see this one and this one, they are from the maybe the public kindergartens or the city kindergartens, and these are from some maybe kindergartens in the country or from the private. It differs a lot. I will just stop here. Okay.
Sure. That's really interesting, and really appreciate that. I'm not going to show some PowerPoint slides on the overview. I'm going to show them on the innovation, and Megan's combining hers. So just very broadly, in the US, early childhood is a public-private system, mostly private, mostly funded by parents. There are federal funds from the US government that go to states, and states are required to have a plan. But like in my state of Connecticut, that funds less than 20% of the childcare that happens or the preschool that happens. I'll use those words interchangeably because they're really part of the early childhood system. It's very unaffordable for families. In the US, most families pay as much for childcare as they pay for rent. So it's the same cost per month. And because of that, a lot of families pick informal and lower quality because they have to go to work and make money, and some people just can't afford it. So even wealthy families complain regularly about the cost of childcare. At the same time, programs can't afford to pay their teachers a living wage, because without a public subsidy, the full cost of high quality is just out of reach. So then programs don't charge what it really costs, and then they pay their teachers less than the living wage. And so the quality is eroded because it's hard to attract and keep good teachers. I ran childcare for many years, and my most common memory is finding a little sticky note on my desk saying, I need to talk to you at the end of the day, which meant I'm leaving. And there's about 40% turnover a year. And I actually got involved with politics and policy because I faced that again and again. And my own daughter had 11 different teachers as an infant, and I understood what that meant for attachment. So this problem's been going on. I'm old now, so this problem's been going on for years. And in the United States, there's an ongoing debate about the role of government in supporting social programs like childcare. In my later talk today, I'm going to show where the US lands on spending on children and families, and it's very low overall compared to other industrialized nations. As a rule, health and safety is regulated, so there are inspectors that go in across the country to make sure children are safe. We're very strict about background checks to make sure criminals aren't taking care of children. There's a lot of focus on health and safety, but there's a total lack of national standards on quality. I'm from Connecticut, which has some very high quality. About a quarter of our programs are nationally accredited, but that's a private system that programs have to pay for by themselves. And Connecticut is a wealthy state. It's one of the wealthiest states in the country, so more programs can afford that. But across the country, the number's more like 10%. COVID has exposed a very fragile system, and it's estimated that we've lost 10 to 20% of our programs for good across the country. Connecticut's lost 1%, but again, we have a lot of philanthropy. There's a lot of individual wealth that's helped hold it up, and the federal government sent money out to help. But across the country, the system is really fractured, and President Biden has proposed a $450 billion system that would make it affordable for all families, that would pay teachers the same as school teachers. It's an incredibly aspirational bill. It looked like it was going to pass, but it has stopped in its tracks. So we're still where I said we were, unfortunately. I love to come back in 5 years and tell you that the United States has made great progress. But like Megan, we're in this phase of shifting from a private system toward a more public system. And both of our nations, for different reasons, have a lot of tension there, and it's hard to make progress. So I'm going to turn it over to Megan to talk about some of the strategies and innovations you're using in China to address the access and quality issues.
Okay, I will go on the share. And I remember that the 6 common problems that our countries face. That's very good, and it summarizes the problems that we face together. And in 2018, our central government, we have some policies about the early childhood education. For example, we aim that by 2020, the gross enrollment rate for the 3 years preschool will reach this 85, and by 2020, we will train 200,000 teachers and kindergarten principals for the career. And also we standardize the development of private kindergartens and conduct a clarified registration of non-profit private kindergartens. So since now it's 2022, we have already completed these numbers, these aims. And also we have the legislation of preschool education law. Now it's in place. I think maybe this year it will be we will have this law. This law will comprehensively standardize from the following aspects. The first is to improve the hosting system and increase the supply of the resources. That's to strive to solve the problem of difficult admission, because we don't have so many kindergartens before. And the second is to improve the investment system to enhance the guarantee of the funds. And the third is clarify the management system to promote the standards operation of the kindergartens. And the fourth is to strengthen the awareness of quality, improve the quality of teachers, and to strive to solve the problem of teaching well. The fifth is strengthen the legal responsibility, strengthen supervision, and strive to solve the problem of manageability. And also we have some very specific rules to improve the quality of kindergartens. For example, we have the government have strengthened the link between the kindergarten and the primary schools. We have a policy that comprehensively to promote the implementation of school preparation and adaptation education in kindergartens and primary school to help children smoothly transition from kindergarten to primary school. And we should change the situation of attaching too much importance of knowledge. You know, since Chinese, the parents like the children to learn a lot of knowledge, how to write, how to spell, just things like this, but put less attention about the ability of the children, the ability to learn. So the government policy pay more attention about this and have make the kindergartens and the primary school pay more attention about this. And also the government pay more attention about the activities in kindergartens. For example, we have the Anji game. It was launched in Anji in Zhejiang province, and it is some kind of method that is learning through play, just as the Lego promotes, and using some natural resources, and children can play outdoor games independently. The teachers will, you can see like this, the teachers can observe the children when they are playing, and the teachers can give them help or guidance when the children, they need the help. And this will help the teachers from some rural areas in China, that if you don't have so much teaching experience, or you don't know how to guide the children, you can just observe, and when the children need your help, you can provide some help. This can solve these problems. You can see the pictures of the game that the children are playing. So that's all for my share. Thank you.
Megan, I wish I was with those children playing. I love those pictures. So special.
Yeah. Yeah, these games actually, since this area, they have a lot of natural resources, just as bamboo or woods. So the outdoor toys are many are made of the wood or bamboo. So they have the ladders or something like this, and the children, they can play many natural materials.
Can I ask you, can I just follow up with a question that was in the chat? Was it Jean who asked, but like in China, like how much of the curriculum is about learning to love learning and how much of it is about getting the skills for kindergarten, or for, not for kindergarten, for school? You call kindergarten different.
Actually, we have our national guidance about the, we have three documents about our early childhood, and the first one is 教育指导纲要 education guidance for the mainly the general, very general, and it divides the learning for 5 aspects. For example, the science, or the arts and music, and health, and the social skills, and another one is language. We have these 5. So in the daily life for kindergarten, you can have some learning activities about these 5 aspects. And now in China, the kindergartens, you can divide your own curriculum. You can use some guidance books for the children, and you can also just all games. The government won't let you have any kinds of fix the curriculum, and the kindergartens, the principals, you can decide what kind of activities you want to have. So there won't be a very specific percentage for the learning of a game. We are now many kindergartens are also learning through play, and for some we call the caring, some caring, how to say?
Yeah, caring. You're saying the right thing.
Also, it's also a part of our education. It can also be a part of game, and so it depends the ability of the principal and the ability of the teachers a lot. Yeah,
Megan, whenever I hear you speak, it could be we're in the same country, because these are some of the exact issues, and I bet others on the call too.
yeah.
And it's nice to hear that play is a part of the learning, and I'm sure Anna Maria is happy to hear that, because Lego promotes that. I'm going to talk about a Connecticut innovation. It'll take me about 5 minutes, and then we're going to open it up for discussion. So it really helped, Jean, to put that in the chat, because it was a really good follow-up. So feel free to put questions in the chat that we can all share if something hits you while I'm speaking. I'm not going to give like the overall approach in Connecticut to these problems. I'm going to talk in a more micro way about one strategy that we're using in Connecticut. And this may be something that happens in your country. It's in Connecticut, my state, we're proud. We call it a state of innovation. A lot of things have been invented here. And can you see my screen now?
Yes, but we're seeing your desktop.
Oh, I'll stop sharing my desktop. Let's try a new share. Okay. How about that? You're seeing yourselves on my desktop. Okay. How about now?
Yeah.
Okay. Okay.
Do you see a map?
We do, yeah.
Yes.
Okay. Just for context, I'd show you I'm in charge of early childhood for this teeny tiny state. It's about 3 million people. It's the state of Connecticut, and it's right next to New York City. Many, many people work in New York City here. And I'm going to talk about one of our innovations to deal with some of the problems I told you about: affordability, access, and quality. In Connecticut, we have child care centers, and then we have family child care homes. And family child care homes are where someone runs a early childhood program in their home. They can take 6 children alone, And then they can take 3 after-school children, so they can take up to 9 during the day, but they can take up to 9 if they have help. And so this is one way that we can offer early childhood. And for children under 5, it's home-based. It's mixed age, so children are getting a natural experience, and it is checked for health and safety. And so our problem was increasing high quality early education in Connecticut. And we have a lot of it in the United States, we call them childcare deserts. I don't know if that's a term used around the world, but almost half of our state does not have childcare that's accessible to families, that is formal and overseen, et cetera. But in areas that are rural and that have low income families where people might not have transportation, these family childcare homes spring up in neighborhoods. And we see a real opportunity to use this to expand access, to let families get childcare in their native language, because very often parents choose this because they want their child in, say, a Spanish-speaking program. But we've been losing capacity over the years. These programs can be isolated, and we wanted to assure quality. So what we did was we've created networks of family childcare homes. So across that little state, we have 11 networks that are professionals that support these family childcare providers, so they're not so much on their own. And families like family childcare because they're small, so they feel like, especially for the younger children, infants and toddlers, they get more attention. And then, but they also can be isolated when they're caring for children. But for families, that should be under a problem. But there are flexible schedules, and they are located in these childcare deserts. But since the late 90s, the number of family childcare homes have been going down, so we've been losing access. But the workers unionized in about 2011. And so the steep curve started to change a little, but we were still losing childcare. And now we've added the childcare networks to that. Hold on one sec. The show froze. Let's see, let me get back there. Okay. So what we've done is we have added these networks, and what they do is they go out and they provide coaching. They also provide professional development, and we give scholarship for classes in college on top of workshops. We have networks where they can buy things together. Anne-Marie, I'm going to keep using you. Like they could go to Lego and say, we're going to buy the Lego for all these programs for this whole region, and they might get a discount. That's been helpful. And then most of them don't really see themselves as businesses. They start to bring in 1 or 2 kids, and they're not really keeping books, and they're a little fragile. And then they're operating without thinking about their business. So we provide business support. And during COVID, we provided nurses for them to call 12 hours a day, and we brought them supplies and gloves and masks and that kind of thing. So this has helped to stabilize the loss, and we hope soon it will increase the number of family childcare homes. We have some good evidence during COVID. I love this chart because you see that family childcare programs closed like many programs during COVID, but they didn't have to close in this country, or certainly in this state, some stayed open. But you can see that as we opened, these are new. We opened these during COVID with a funder, with a private philanthropy gave us some money to do this. And we opened the 11 networks. We started calling them. We provided resources. And then where it says 1029, the governor assigned $5 million more for us to buy spaces to try to help them stabilize. And you can see the number of programs opening going up. So this is a tiny snapshot of that other, but it really showed us that just a little help. This is so much less expensive because the big centers, to help the big centers, we had to spend $100 million to get this kind of growth. And the family childcare homes, we found a little money went a long way. And this is just a map of our state, and each one of those little dots is an open family childcare center. So you can see there's still parts of the state that don't have a lot of family childcare homes, and those same parts don't have a lot of centers. So we're hoping that as we provide more supports in regions that we can grow these and improve the quality, because a lot of these providers don't see themselves as teachers. And so we work to bring them professional development and help them get accredited. We will pay all their fees to join a professional organization, so they get those ongoing supports. And so we just thought this was a unique approach to expand access, improve quality, and keep equity at the center, because these tend to be low-wage women running these small businesses, and they tend to be in places where families can't access traditional centers. And so we felt like it helped both the parents and it helped the children because of the quality and the individualized care. And this is the last slide I'm just showing, is that in the United States, when we implement policies like this, it's very often through nonprofit partners. And so this is an example of a network that's trying to tell people in their region, this is what we do. But it's a private business, private from the government. We put out a contract and say, if you can help us in this region, write us a proposal, and then we pick the best proposal, and that nonprofit does the work. And so all our kin has been doing this work for a long time. And this just shows you, this is what they believe and this is what they're doing. So I wanted to share this from Connecticut because I thought it's a little bit different. But it's something, talking to South Africa, for example, a lot of their programs tend to be home-based. And so this is an approach I think that could work in different parts of the world. And we are seeing pretty big impacts from small investments. And we do believe it addresses equity. So I'm gonna stop there and then just see if you all have things to either share about your country that have been ticked off that you think are good to share, or if you have questions for Megan or for me.
May I go? Yes, I do have questions, and I can tell you also about Mexico if you're interested. First of all, I wrote in the chat, the supervision for those home centers, I mean, the state provides that supervision. How is it done?
Yeah, good question. How we do it in Connecticut is the state, we have inspectors that go out unannounced once a year, so they all know somebody's coming. But if a parent issues a complaint or a neighbor issues a complaint, then we go immediately and do an unannounced inspection. So that's not cheap, you know, that system to oversee it. But we have inspectors that speak the language of the provider as well. So, you know, we do assign based on that. But yes, there is that, but there's not like the level of scrutiny and rules that are in a center. Like they don't need sprinklers. They don't have as many health and safety requirements as a center, for example.
My second question, thank you. Very interesting. My second question has to do with age. In Mexico, we divide early years as 0 to 3 and preschool from 3 to 5. It's 3 years of preschool. And we do have compulsory preschooling since I think it was 2008, more or less. So about 90+% of 5-year-olds are enrolled, 80+% are enrolled for 4-year-olds, and for the 3-year-olds, it's almost 40%. So that's the huge, the big gap at the moment. But I've worked recently from 2016 to 2018, last government, organizing the national curriculum for 0 to 3-year-olds as head of the curriculum department in the Ministry of Education. So we do have some standards for 0 to 3-year-olds, but I think it is a good thing to have a larger vision from 0 to 5 at least, although there are very different ways to approaching it, because from 3-year-olds in this country, it has to be through schooling, whereas from 0 to 3, there are three ways of you can do it. It's daycare. Daycare has been in place for a long time, particularly for those that are working, so that you have access to some sort of daycare, not necessarily everybody. Many of those are private, but if you are fully employed, you should have access. And if you go to a private daycare, that would get paid through your national system or so. Then we had a different one, which is very, very similar to the one you were talking about, which was doing through home care, that this government finished it. It was a disaster because 350,000 children had been attended through that system that had taken quite a few years to organize through the neighbors. It was mainly for single mothers that were working. But the main difference from leaving your child with someone you know from your neighborhood, it was precisely supervision, because the government was giving money to those women organizing the care within the homes, as well as the moms, to pay for that care. And there was a lot of standards and supervision going on. It was a two-way thing, which had a lot of things to, I mean, a lot of room for improvement, but I think that it was a bad decision to get rid of that one. And the third, which I have been very much involved in recent times, had to do with giving information to families in order for them to care about their children within their homes, with home visiting. So that I have been advised subnational governments, like state governments, to put in place such programs, which with the COVID had been very, very interesting, because we've had to do it through WhatsApp, the phone, and so on, and not the places where the family, particularly the mothers, used to come and have talks and social emotional learning, reading skills, more reading books to children rather than other things, interaction, good quality interaction is the kind of things we were doing in that third area. So I don't want to take up any more time, but
no, it's really interesting. You have pieces of everything. I think I'm curious what happens with infants and toddlers. I think, Elisa, ours is similar. We sort of see it as 0 to 3 and 3 to 5. Ours tends to be more private, public, but I think it's similar. And the 3 and 4-year-olds are seen as preschool. It's just not in the schools for the most part. Probably a quarter of them across the country are in schools, maybe, but mostly it's private. But what are others? How are others dealing with the infant and toddler care in other countries? Because this is as more and more women are in the workforce, I'm curious. It's the area we have a shortage because it's so expensive, because you need more adults. So we have too many preschool spaces and not enough infant spaces. I wonder if that's other countries are dealing with that.
I can join in if no one's talking.
Yeah.
I don't want to steer the conversation. First, it's so good to see that the rest of the world is having similar problems. We are all trying to see how can we get kids into schools, how can we let their parents have an opportunity to go to work. We are all doing this. Although here in Portugal, we are not we are more state, although most of it is private, the state funds most of it, either directly by making a call and people can can work with it and say, oh, we want to apply and to have an opportunity to take that contract, or by supplying, for example, religious, doesn't have like an application, but it's a standard. They don't bring religious activities, but it's the standard to support children. We don't have the same local, very small program. But for me, the problem is about quality, because, for example, I advise an organization that has 5K teachers, and we are always thinking we have 5K very smart people at the start of their career, and we want to take advantage from one to teach to the other. How do you do that? That's our questioning. But for me, the most important is, how do we maintain quality throughout those 150K, 150,000 children that we have? How do we maintain the quality? What are our standards? How do you think about it in the US, or anyone who wants to talk to it? How do you say, like, oh, this is working? Because the main issue with us is that it's expensive. The only feedback that we get is, oh, this is expensive, or this isn't as quality. But okay, we want to improve. Make it cheaper. Is that the goal, or
Yeah,
are
I
there
know.
any goal posts?
I think that in early childhood, and this is true in all of education, and I think Megan deals with this, is, if you're looking to make a profit, then you want to take in as many kids as you can per teacher, and that hurts the quality. And people don't want to pay taxes, so they don't want to, that's what's holding back the United States moving forward, is they don't want to pay what it costs, even though they're paying more in the long run. So because that child needs other remedial things. But we are in Connecticut launching a 3-tiered quality, so parents will know this program meets basic health and safety. This program is step 2, and step 3 is accreditation. And then when the state subsidizes, we pay like 30% more for level 3. So this is new. We're going to see if it works. It's one way. I don't know. Can others share what they're doing to encourage or require quality? Because I think Paulo's question is the question. With all these competing demands, how do we get to high quality? Come on, someone solve this puzzle, right?
Well, I give you a question for that. Do you think we need standards in order to attain quality, or not? I mean,
well, I think we need standards, but what's happened in the United States is that when they bring the preschoolers into the public school and they put standards on them, they don't get to be kids. They're not having circle, they're not making choices, they're not building that executive function. So the challenge is, I think the challenge around the world is letting child development inform what those standards are, versus, like, it's not about where kids are going, it's about how do you give them what their brains need now. And it's so hard, at least in my culture, for that. Jean, were you going to add in something?
Yeah, I think so. Thank you so much for this. Like Paulo, I'm so impressed with all the things that we have in common, as you started off with, Beth. I think that we in Canada, we've looked at quality very intensely at different stages. And if you look up quality by design, that was done by our Childcare Resource Center. And what my take from this, and I'm not directly in the childcare world, I'm a child psychiatrist, but what I take from it is that we've got visuals, we've got pictures, we've got imagining about what quality needs to look like. But once we start getting into the definition of what is quality, and once we go beyond minimal standards of ensuring, like you were talking about the tiered system, it becomes very, very murky. And so what we've learned, and what I've learned, is that it's so essential that people come together to determine, what does quality mean for me from the micro level to the macro level, and then there is an implementation science approach to say, well, how do we go about doing that? So for example, mentoring and reflective practice is rising up to the surface to say that this is absolutely how you make change, how you think about children as competent and capable and co-creators, and that it's not about what I call stuffing the duck, you know, getting that curriculum in them so that they're ready for it. So quality is a process. It's a process as well as an outcome. And I had wonderful conversation for a recent project with New Zealand. And if people are looking to see the New Zealand education research, the ERO, I can't remember what that has done a whole lot of work looking at quality, the issue of quality indicators rather than standards. So quality indicators rather than standards, as well as some rubrics for reflective practice for centers to say, where am I in this emerging to innovating kind of rubric? Anyway, enough said. So it's fabulous conversation. Thank you.
Well, you just made it more fabulous. Now I'm going to have to go look up New Zealand, because I have heard we were hoping to have Lynn Kagan here today, but this is actually much better format. But she's written 2 books that compare systems around the world. And she'd said Australia has a good quality system. Like there are a couple of countries that have taken this on. New Zealand sounds like is one, as is Australia. So I'm going to look up New Zealand.
Yeah, New Zealand, and it's the ERO, Education Resource.
ERO.
Yeah, if you, Beth, I'm sure through Dominic, because I'm part of Karanga, I can connect you with Sandra Collins, who is the person who's responsible for early childhood and ERO, the Education Review Office, the Education Review
Awesome.
Office. Yeah,
That would be awesome. Thank you.
I'd be happy to share that.
Faye, what is our timing? I'm not paying attention to that.
We are almost perfectly on time. We've got another 3 minutes if you want to do any closing words and wrap up.
Does anyone else want to add in about quality and what they're doing? Angela, do you want to add anything about Colombia? I'm really curious what's happening in Colombia if we have 3 minutes.
Thank you very much. No, I just want to know. I have a question. It's more like how do you follow the quality of interactions? No, I think that is the core of.
That's where it's at. And in fact, if only South Africa is doing some really good work in this area. And Amara from our work group talked about that this morning. Faye, I don't know if we're able to share that or if everyone will get that, but that's where it's at, that social emotional health. And we are implementing in our state something called the pyramid, which helps people understand that at the very base, kids need their basic needs met. And at the very base, all kids need certain kinds of interaction to support their healthy development. But then as you go up the pyramid, different kids need different kinds of attention. And right before this call, I was talking to our child advocate, and the number of young children presenting with trauma who need special kinds of interactions is growing, and early childhood providers as a rule don't have that training. So we need more training on that.
They're calling us back.
Oh, well, thank you, everybody. This was a wonderful conversation. I wish I could spend the day with you in person.
Me too.
Thank you so much.
Thank you, everybody.
Welcome to
Thank you
Colombia.
very much. Thanks, everybody.
Bye. Thank you.